Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Appendectomy. While the word may seem daunting, but today we are here to shed light on its importance and procedure. This prevalent surgical intervention, also known as the appendix removal, holds significant relevance for anyone facing the possibility of appendicitis. So join us as we delve into the intricacies of appendectomy, aiming to provide clarity and understanding to empower you with essential knowledge about this vital medical procedure. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and to help us navigate the complexities of an intricate yet prevalent surgical procedure, such as appendectomy, we have with us the distinguished general surgeon, Dr. Amrut Basava. Dr. Amrut Basava is an esteemed general surgeon possessing extensive experience and expertise in the surgical domain. He obtained his Master's of Surgery degree in General Surgery and successfully completed his residency at Calicut Medical College, Kerala. Dr. Basava's unwavering dedication to providing exceptional patient care is evident throughout his professional journey, characterized by a steadfast commitment to delivering a compassionate and effective surgical interventions. Presently affiliated with Shreeya Multispecialty Hospital in Dharwad, Sir is renowned for his adeptness in performing a diverse array of surgical procedures with precision, thus establishing himself as a highly respected and valued member of the healthcare community. Dr. Amrut Basava, THIP Media welcomes you, sir.
Thank you.
Thank you so much for being with us today, sir. Sir, we all understand that appendicitis is a very painful condition. And I'm sure you must have come across people who could still be scared of undergoing a surgical procedure. So just in line of bridging this gap up, I'm going to start this discussion with the most fundamental question, that what exactly is an appendectomy?
Yeah, as you said, appendectomy, appendicitis is a very common condition. So before that, since the topic is about appendicectomy, or it's also known as appendectomy, both are one and the same.
Okay.
An appendectomy or appendicectomy is a surgical procedure in which the appendix is removed.
Right.
So an appendix is a vermiform, is also known as vermiform appendix. It's a small worm-shaped tube-like organ which is present near the junction of the small and the large intestine. It is usually located in the right lower part of abdomen. Appendix is a vestigial organ. It is having no obvious function in human body, so its removal is justified in case of pathological conditions. An appendicectomy or appendectomy is typically performed as an emergency procedure to treat appendicitis. Appendicitis is nothing but inflammation of the appendix, wherein it becomes swollen, it becomes sore and infected. Other uncommon conditions include tumors or growth of the appendix.
Okay. All right. So you just mentioned about the various indications that could actually necessitate the removal of this vestigial organ. Just help us understand the different techniques that are used to perform the procedure.
Okay. So an appendicectomy can be performed as an open surgery or a laparoscopic surgery. Laparoscopic surgery is also popularly known as keyhole surgery. In open appendectomy, the surgical incision or the cut is about 2 to 4 inches, and it is made in the lower right side of the abdomen, and the appendix after dissection, it is removed through the incision. In laparoscopic appendectomy, 3 small incisions are made in the abdomen, and the laparoscopic instruments are inserted. The abdomen is distended by pumping carbon dioxide gas into the abdomen for proper visibility. And after dissection, the appendix is removed through one of the incisions.
Okay. And what factors would you say might influence the decision between an open and a laparoscopic procedure?
Yes, certainly there are some factors which actually influence the choice of the surgery. And firstly, among them is the patient characteristics, the age
Okay.
of the patient, the gender of the patient, and whether the patient has any medical comorbidities like, diabetes, hypertension, cardiac disease. All these things make a difference.
Okay.
Secondly, the severity of the appendicitis, based on the clinical manifestation, preoperative inflammation signs, we judge the severity of the appendicitis. Thirdly, it's based on the surgeon's clinical experience, because laparoscopy to perform laparoscopy, the surgeon must be specifically trained for laparoscopic procedure. Lastly, it also depends on the timing of the day. They say whether it's during the day, in the evening, or at night. So the timing of the day also has some influence on the choice of surgery. But
Okay.
overall, with appropriate indication, both the procedures are of equal value in treatment of appendicitis.
Okay. And like you just mentioned that there could be people with previous medical history such as diabetes or any other medical condition. So can complications arise after undergoing an appendectomy?
Yes, there are some possible complications of an appendectomy, which include bleeding, wound infection, bowel obstruction, injury to the nearby organs like intestine, small or large intestine. And sometimes, if the appendix bursts during the surgery, it can
Okay.
lead to inflammation of the abdominal cavity, which is called as peritonitis, or sometimes it can lead to collection of the pus locally, which is called as abscess. So these are some uncommon but possible complications.
Okay. And how long does it typically take to recover from this procedure? And what is the expected downtime?
The recovery time depends on the type of the surgery. In
Okay.
case of laparoscopic surgery, one can return to work or normal routine 1 to 3 weeks after the surgery. In case of open surgery, it may take around 2 to 4 weeks.
Okay. And are there any alternatives to the surgical intervention for treating appendicitis?
Some people with appendicitis may improve from conservative treatment with antibiotics and may not need surgery.
Okay.
Some mild cases of non-complicated appendicitis can be treated with antibiotics alone.
Okay.
However, I would like to mention the initial success rate from ranges from 60 to 84%, and there is a persistent risk of recurrence for at least 5 years after the initial antibiotic therapy.
Okay. And since you've mentioned that, the recovery from the surgery, it usually depends on the patient, right? So would you recommend any dietary or lifestyle changes after undergoing an appendectomy that could aid in recovery?
Yes, of course, diet and lifestyle plays a very important role in recovery. A healthy, nutritious, well-balanced diet is always advisable for early recovery.
Okay.
Eat plenty of fresh fruits and vegetables, consume good amount of protein, and drink plenty of water.
Right.
Gradually, as we advise rest after the surgery, we tell gradually resume the normal activities over a few days, not
Oh,
immediately.
okay.
Include regular gentle exercises like walking to help in early mobilization and faster recovery. And lastly, avoid strenuous activities that strain the abdominal muscles, such as lifting heavy weights.
Okay. Right. So I'm just going to summarize this for the people or the patients who are undergoing the procedure. Can you provide a post-surgery checklist for patients to adhere to, following their surgical intervention or management?
Well, apart from the dietary and lifestyle advice, which I mentioned earlier, that is the
Right.
first and foremost thing.
Mhm.
There are some certain other points to consider after the surgery,
Right.
like avoid bathing until the incisions are healed to maintain the wound hygiene. Basically,
Right.
the wound is to be kept dry and avoid wetting of the wound.
Right.
Then there is rest. We have to take adequate rest. Having a fast lifestyle with inadequate rest will slow the recovery.
Mhm.
Then we are supposed to consume 6 to 8 smaller meals in a day rather than having heavy meals. We are supposed to eat smaller portions and more frequently during the day.
Okay.
Then, like I already said, drink plenty of water and caffeine-free fluids. Caffeine is unhealthy. And sometimes, if the patient has constipation, stool softeners may be taken. Laxatives, what we call, they can be taken. Last but not the least, the patient is supposed to contact the doctor in case of warning signs such as fever, vomiting, loss of appetite, that is, loss of hunger, if there is any redness, swelling, or bleeding, or any sort of drainage from the incision site, if there is an increased pain from the incision site, if there is a coughing or breathing difficulty, if he has abdomen pain or swelling, distended abdomen, or sometimes constipation or diarrhea, if any of these problems occur, the patient must be feeling free to contact their doctor, and these can be managed appropriately.
Okay. So that was very insightful, sir. And we appreciate your presence with us today.
Thank you.
And I'm hoping that the enlightening information shared will be valuable to many families out there. So thank you so much for joining us.
Yeah, thank you very much, Dr. Soumya, and the whole health tech team, THIP team. I wish you all the very best. Thank you for this opportunity which you have given me. All the best. Thank you.
Thank you. It's really been a pleasure, sir. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.